I want you to look at your ankles right now. Not later. You see them swollen right now. You notice that by the end of the day your shoes don't fit properly anymore, that when you take off your socks, there's that indentation in your skin as if the fabric has eaten away at your flesh. If this happens to you, the first thing you do is panic. It's normal, because everyone has told you the same thing. Swelling in the feet and ankles after 60 means heart, kidney, or circulatory problems. And you go to the doctor, they order tests, tell you everything is fine, and you're still left with ankles like two balloons at the end of every afternoon, with no explanation, no solution, with that underlying anxiety that keeps you awake at night. Well, today I'm going to tell you something that probably no one has told you yet, and it completely changes the way you understand this problem. Most cases of swollen ankles in people over 60 have absolutely nothing to do with the heart, the kidneys, or any serious illness. They have to do with a system that conventional medicine almost completely ignores. A system that's in your body, that works every second of your life, and that after 60 starts to become sluggish, and congested. It's called the lymphatic system. And in the next few minutes, I'm going to explain exactly what it is, why it gets blocked, and most importantly, how to activate it at home in less than 5 minutes a day with a habit so simple you'll wonder why no one ever taught you this before. My name is Alejandro Gomez. I've been working with patients for over 20 years, and in those years I've learned one thing. The current medical system is very well designed for acute problems, for emergencies, for crises, but it's very bad, truly very bad, at listening to people like you who have persistent chronic discomfort, which doesn't kill you, but does steal your quality of life. Swollen ankles, heavy legs, that feeling of tiredness that settles in your feet even before the morning is over. That doesn't show up in any blood test, but it exists, and there's a solution. Stay until the end because what I'm going to show you is something you can start doing today, not tomorrow, today. When someone over 60 goes to the doctor with swollen ankles, there's an almost automatic protocol. Blood tests, electrocardiogram, blood pressure check, echocardiogram if the doctor is thorough. And if everything comes back normal, they tell you, it's just age, move around more, drink water, put your feet up. End of consultation. And I understand my colleagues, I don't blame them. The system gives them 8 minutes per patient, 8 minutes to listen to you, examine you, decide, and write it down. Under those conditions, the protocol is the only viable option. But the protocol has a huge flaw. The protocol looks for serious illnesses, and when it doesn't find any, it assumes there's no serious problem. But between a serious problem and no problem, there's a vast territory where millions of people live, the territory of a system that malfunctions without being broken. And that territory is exactly where the congested lymphatic system lives. Let me explain something important. When the body swells, what's happening is that fluid accumulates in the tissues. This fluid is called edema in medical terms. The word edema comes from Greek and simply means swelling, nothing more frightening than that. Now, where does this fluid come from? Why does it get trapped there? There are two main reasons. The first is that the heart isn't pumping properly, and the pressure in the veins increases so much that fluid leaks into the tissues. That is serious. It needs to be treated. But there's a second, much more common reason, especially after age 60, that almost no one mentions. The system responsible for collecting this extra fluid isn't working properly, and that system is the lymphatic system. Before we continue, I need to ask you something. If this video is helping you, if you recognize what I'm describing, please write in the comments where you're watching from and how old you are. It doesn't matter if you're 61 or 85. I want to hear from you because this channel exists for real people with real problems, and every comment helps me understand what else you need to hear. And now I'm going to ask you to imagine something with me. Close your eyes for a moment if you can. Imagine that there are two systems of pipes in your body. The first is the one we all know, the cardiovascular system. The heart pumps, the blood leaves through the arteries, reaches the tissues, collects waste products, and returns through the veins. You learned that in school. There's a powerful pump, the heart, that keeps everything moving. Now imagine that next to that system there's another system of pipes, much thinner and more fragile, that act like a sewer system. Its function is to collect all the fluid that leaks out of the blood vessels, collect cellular waste, toxins, bacteria, damaged cells, and carry it all to lymph nodes are where it's filtered and cleaned. That's the lymphatic system. And here's the crucial difference, the one that changes everything. The lymphatic system doesn't have its own heart, it doesn't have a pump, It depends entirely on the movement of your muscles to function. Every time you move your legs, every time you walk, every time you climb stairs, your muscles contract and compress those thin, straw-like lymphatic vessels, pushing the lymph upwards, towards the lymph nodes. It's exactly like squeezing a tube of toothpaste. The pressure makes the contents move. Do you understand the problem now? After 60, many people move less, not because they're lazy, don't misunderstand me, but because they have knee pain or are afraid of falling, or simply because their bodies no longer crave movement with the same intensity. And when movement decreases, the lymph stagnates, becomes thick and sluggish, and the fluid that should be collected and eliminated accumulates in the tissues. Where does it accumulate first? In the lowest parts of the body, ankles, feet, lower legs. Swollen ankles, a feeling of heaviness. That tight skin at the end of the day. It's not your heart, it's your lymphatic system that needs unblocking. Here's something I think is crucial for you to understand, because if you don't, you won't take the 5-minute habit seriously. The lymphatic system behaves quite reliably throughout your life. As long as you move, it works. As long as there's muscle activity, the fluid flows. In young people, even a sedentary day is quickly compensated for because the system still has tone, elasticity, and recovery capacity. But after 60, several things happen simultaneously. First, the lymphatic vessels lose elasticity. Just like arteries, just like skin, lymphatic vessels become more rigid with age. They need more stimulation to move. Second, muscle activity decreases. Even people who consider themselves active move considerably less than they did in their 40s. A sedentary lifestyle creeps in subtly. More hours sitting watching television, avoiding stairs, reducing walks for fear of pain. Third, and this is what surprises my patients the most, hydration is often insufficient. Many people over 60 don't feel thirsty as intensely as before and drink less water. This is paradoxical, because when you don't drink enough water, the lymph becomes denser, more viscous, and circulates even less effectively. Drinking water doesn't cause swelling. On the contrary, it helps the lymphatic system function better. Fourth factor, heat. Swollen ankles worsen considerably in summer with high temperatures. Heat dilates blood vessels and causes more fluid to leak into the tissues, further saturating an already sluggish lymphatic system. Are you seeing the whole picture? It's not a single problem. It's the sum of several factors that converge precisely at the time of life when we are least prepared to handle them. But the good news, and I say this as a doctor and as someone who has seen this hundreds of times in my practice, is that this system responds very well to simple stimuli. You don't need medication, you don't need expensive equipment, you don't need to go to the gym or do anything that will cause you pain. You need 5 minutes a day, consistency, and to know exactly what to do. Here, I have to be absolutely honest with you because medical responsibility demands it. There are signs that ankle swelling warrants an urgent visit to the doctor. Not tomorrow, today. These are them. The swelling appeared suddenly within a few hours or overnight and only in one leg. That could indicate deep vein thrombosis, which is a blood clot in a vein. And that is an emergency. The swelling is accompanied by shortness of breath, chest pain, or palpitations. That could be cardiac and cannot be ignored. The skin over the swollen area is red, hot to the touch, and there is a fever. It could be an infection that needs treatment. The swelling does not subside at all when you elevate your feet for at least 30 minutes. If you elevate your legs and there's no improvement in half an hour, that warrants evaluation. If none of these warning signs are present, if the swelling is bilateral, in both legs, if it's greater at the end of the day than in the morning, if it improves when you rest with your feet elevated, and if your blood tests and heart have been checked and are fine, then what you most likely have is what I've described, lymphatic stasis, which is the medical term for lymphatic stasis. Lymphatic stasis. Repeat after me, lymphatic stasis, or stagnation of the lymphatic system. The fluid that should be moving has become stagnant, and that can be resolved. Now comes the part you've been waiting for, and I want you to take note. Seriously, it's simple, but simplicity doesn't mean it doesn't work. In fact, in medicine, the simplest things are often the most effective. This habit combines 3 elements that together activate the lymphatic system very efficiently: position, movement, and breathing. All 3 are necessary. If you only do one, it only works partially. If you do all 3, the effect is completely different. Let's call it the morning drainage protocol. You'll do it every morning before getting out of bed, while you're still lying down. You don't need special clothing, you don't need any equipment, you don't even need to stand up. The first element is the elevated position. Before doing anything, place 2 pillows under your legs so that your ankles and calves are elevated above heart level. If you have a thick pillow, one may be enough. The idea is simple. Gravity will do some of the work for you. Lymph, like any fluid, tends to flow downwards. By elevating your legs, you're giving it a downward path towards your torso, where the system can drain more effectively. Stay in that position for at least a minute before starting the movements. The second element is the pumping motion. We begin with what's called the ankle pump in physiotherapy. It's so simple it seems impossible, yet it's one of the most scientifically supported therapeutic exercises for activating venous and lymphatic return. With your legs raised, flex and extend your feet rhythmically. Point your toes toward you as if you wanted your toes to touch your shin. Then push them down as if you wanted to stretch the arch of your foot up and down, slowly, rhythmically, without forcing it. Do this for a full minute. What's happening in there? Every time you contract the calf muscle, which is called the gastrocnemius and soleus, you're literally squeezing the lymphatic vessels inside and around that muscle. This creates positive pressure that pushes the lymph upward toward the lymph nodes in your knee and groin. After the ankle pumps, do foot circles. 10 clockwise circles, 10 counterclockwise circles. This also mobilizes the more superficial vessels in the ankle, which are the ones that become most congested over time. The third element is diaphragmatic breathing. This is the element that most surprises my patients and is also the most powerful. Did you know that the movement of the diaphragm, the muscle you use to breathe, acts as a second pump for the lymphatic system? When you take a deep breath, the diaphragm moves down into the abdomen as you inhale and up as you exhale. This movement creates pressure variations in the chest and abdomen that literally draw lymph from the lower extremities into the thoracic duct, which is the large central collector of the entire lymphatic system. Imagine it like the main drain of a bathtub. It doesn't matter how much you drain the smaller tubes if the main drain is closed. Deep breathing opens that drain. So, while you're doing the ankle movements, breathe like this. Inhale deeply through your nose for 4 seconds, feeling your abdomen expand outward, not your chest. Hold your breath for 2 seconds. Exhale slowly through your mouth for 6 to 8 seconds, completely emptying your lungs. This slow, deep breathing not only activates lymphatic drainage, but it also activates the parasympathetic nervous system, the body's calming and repair state, which reduces systemic inflammation and improves vascular tone. It's a huge bonus. Do 10 full breaths like this while continuing with the ankle movements. The fourth step, the upward massage. After the 2 minutes of movements and breathing, sit on the edge of the bed. With both hands, apply gentle but firm pressure to your foot, starting at your toes and sliding your hands upward, toward your ankle, then your calf, then your knee, always in an upward direction, never downward. Why only upward? Because the lymphatic vessels have internal valves that only allow fluid to flow in one direction, toward the heart. If you massage downwards, you're going against those valves. If you massage upwards, you're pushing with the flow. The pressure should be gentle. You're not kneading bread. Think of the pressure you'd use to clean a window with a cloth, just enough to make it glide, but without hurting your hand. The lymphatic system is superficial, just under the skin, and doesn't need deep pressure. Spend 1 minute on each leg. 5 minutes total, 2 for mobilization and breathing, 2 for massage, and an initial 1 for pure elevation. If you do this every morning before getting out of bed for at least 3 weeks, I guarantee you'll notice a difference. The difference. I'm not promising you magic. I'm talking about basic physiology. The scientific evidence on manual lymphatic drainage and activation through muscle exercise is well documented. It's not alternative medicine, it's applied physiotherapy, accessible to everyone. The morning protocol is the core, but there are other daily habits that can enhance it or completely ruin it. I'll give you the most important ones. The first is hydration. I mentioned it before, but I'll repeat it because it's critical. Drink between 1.5 and 2 liters of water a day, unless your doctor has indicated fluid restriction for a specific reason, such as heart or kidney failure. Lymph is a fluid that needs water to move. Without enough water, it thickens and slows down. A glass of warm water, first thing in the morning, before coffee, before anything else, is one of the best gifts you can give your lymphatic system. The second is movement distributed throughout the day. Getting up every 45 or 60 minutes if you're sitting, even if it's just to take 10 steps and come back down, doesn't have to be a walk. Just don't let your legs sit still for hours. Every time you move, even for a few seconds, you're restarting the lymphatic system. The third is to avoid excessive heat on your feet and ankles. Very hot baths, radiators that heat your legs directly, and thick socks in the summer. All of these dilate blood vessels and increase fluid leakage into the tissues. If you're prone to swelling, heat is your enemy. Moderate cold, on the other hand, is your ally. It constricts blood vessels and reduces leakage. The fourth, and I know this might be hard to hear, is sodium. Salt retains water in the body. I'm not telling you to eliminate it from your diet completely, because that's not healthy either. But if you're eating processed meats, canned goods, and other processed foods high in sodium, and your ankles are swollen, there's a direct correlation. Reducing added sodium is one of the quickest ways to improve swelling. And the fifth golden habit that costs €0 is sleeping with your feet slightly elevated. There's no need to exaggerate. Simply having the foot of your mattress about 10 or 15 centimeters higher than your head, or placing a thin pillow under your feet, is enough. While you sleep, your body has 7 or 8 hours to drain the lymph accumulated during the day. Take advantage of it. I want to talk to you about something that goes beyond physiology. I want to talk to you about what I feel when a 70-year-old patient comes into my office with fear in their eyes because they've had swollen ankles for weeks and no one has explained anything to them. The fear these people feel isn't irrational. It's understandable, because after a certain age, the body starts giving signals that you don't know how to interpret, and the medical system often doesn't have time to explain them. And when you don't have information, your mind fills the void with the worst possible scenarios. I'm going to be bedridden. I'm going to be a burden to my children. This is the beginning of the end. I've heard those words literally hundreds of times, and every time I hear them, I feel like we've failed as a system. Because chronic fear doesn't just make you suffer emotionally. Chronic fear, sustained anxiety, raises cortisol, which is the stress hormone. And elevated cortisol increases systemic inflammation, weakens the immune system, and yes, it can also aggravate water retention. Knowledge breaks fear when you understand what's happening to your body, when you stop being at the mercy of vague interpretations and have a clear model in your mind. Fear transforms. It doesn't disappear completely, because prudence is necessary, but it no longer paralyzes you. It becomes action. And that's exactly what I hope you felt today watching this video, that you moved beyond, "This scares me, and I don't know what to do." I understand what's happening and I know how to start managing it, because that small change is what makes the difference, clears throat, between a person who feels like a victim of their body and a person who works with their body. There's a topic I can't leave unaddressed because you've probably already heard about it or will hear about it soon. Compression stockings work. Yes, they work, but there's a right way and a wrong way to use them. Compression stockings act like a skeleton for your veins and lymphatic vessels. The pressure they exert from the outside helps push fluid upward, compensating for the system's weakness. They make sense, especially for people who are going to spend many hours on their feet, on long journeys, or in situations where movement will be very limited, but there are common mistakes that turn the stockings into a problem. The first is putting them on when your ankles are already swollen in the middle of the day. That's like trying to turn off the tap when the bathtub is already full. Compression stockings should be put on in the morning before getting out of bed, when the tissues are still at their baseline level. The second mistake is using an inappropriate level of compression. Compression stockings have different levels of pressure. Those sold over the counter in pharmacies are usually light compression, which is safe for most people. But if your doctor recommends higher compression stockings, these require a prescription and prior evaluation, because in people with certain circulatory problems they can be counterproductive. The third mistake is relying solely on the stockings and doing nothing else. Stockings are an aid, not a solution. If you don't combine them with hydration, movement, and the protocol I've taught you today, as soon as you take them off, your ankles will return to exactly the same state. Doctor, how long will it take to see results? This is the most frequent question, and the honest answer is, it depends. If you've had swollen ankles for weeks or months, if your lymphatic system has been congested for some time, you're not going to see a dramatic change in 24 hours. That would be unrealistic. And I don't want to promise you what I can't guarantee. What I can tell you, based on clinical experience and the scientific literature on lymphatic drainage, is that most people who consistently apply the protocol for 2 to 3 weeks notice in the first week that their ankles are less swollen in the mornings than before, and that the time it takes for them to swell upon waking is delayed. In the second week, they notice that the feeling of heaviness in their legs during the day is less, and that by the end of the evening, the difference compared to before is noticeable. In the third week, the overall pattern has changed. The swelling no longer reaches the same level as before, and the skin on their ankles feels less tight and more flexible. That's not a miracle. It's simply what happens when you consistently give your body what it needs. Consistency is key. 5 minutes every day is much more effective than an hour every 2 weeks. The body responds better to gentle, regular stimuli than to sporadic, large-scale efforts. I want to close with something personal. I've been practicing medicine for over 2 decades. I've worked in emergency rooms, primary care, and private practices, and if there's one thing he's learned in all that time, it's that the human body has a capacity for recovery that we often underestimate. We live in a medical culture that has over-medicalized many problems that could be managed with education, healthy habits, and time. I'm not saying medicine isn't necessary. Of course it is. There are illnesses that require medication, surgery, and all the technology we have. But there are also problems. Many problems, especially those related to aging, mobility, and quality of life, that respond remarkably well to simple interventions when people have the right information to implement them. You deserve that information. It doesn't matter your age, whether you're 62 or 88. The body still has the capacity to respond, to improve, to adapt. What changes with age isn't the body's ability to improve. What changes is the time it needs and the importance of consistency. Start tomorrow morning before you get out of bed. 5 minutes. Elevation, movement, breathing, upward massage every day, and in 3 weeks, tell me in the comments what has changed. I genuinely want to know. You found this information helpful. Then what you need to do now is very simple. If you have a family member or friend who also suffers from swollen ankles and no one has explained this to them, share this video with that person today, not tomorrow. Today, because life-changing information is useless if it just sits in your YouTube history. And if you want to continue learning about how to take care of your body after 60 with honest and straightforward medical information, subscribe to this channel. I regularly post videos on the topics that most affect quality of life at this stage, always with the same commitment, to tell you the truth, even if that truth is sometimes uncomfortable. The content of this video is for educational and informational purposes only. It does not constitute a medical diagnosis, does not replace consultation with your primary care physician or specialist, and should not be interpreted as personalized medical advice. Each person has a different health situation, and what works for most may not be suitable in specific cases. If you experience sudden swelling of the ankles on one leg, accompanied by shortness of breath, chest pain, or fever, seek immediate medical attention. If you have any concerns about your health, always consult a qualified medical professional.